Hi, my name is Annika Vargas, and I'm going to be discussing the epidemiological curve on the San Diego hepatitis A outbreak from 2016 to 2018. So, these are the curves, and first we're going to be discussing figure A, and we can see that hepatitis A cases were relatively high throughout the 1990s, but after the development of the Hep A vaccine in around 1995, and especially after routine childhood vaccinations in 1999 for vulnerable populations, and then mandated nationwide vaccinations in 2006, the number of reported cases has steadily declined. And from 2006 to 2016, San Diego didn't really report any hepatitis cases each year. But once we get to 2016, there starts to be a slight increase. And then in 2017, there was a pretty dramatic spike to around 600 reported cases. This represents one of the largest hepatitis outbreaks in the United States after the development of the vaccine. So, due to this, we can see that there are potentials for increase in development of diseases despite vaccines. And then for figure B, we're going to discuss how this is really representing the epidemiological curve, showing the number of confirmed or probable hepatitis A cases. And this is kind of like on a week-by-week basis throughout 2017. So we see the first few cases appeared in late 2016, but throughout the first several months of 2017, the number of weekly cases increased gradually. And this pattern suggests ongoing person-to-person transmission, not really just like a single source of exposure, such as food poisoning from a certain restaurant. So we can see that hepatitis A spreads through fecal-oral route, and then during this outbreak, transmission was largely driven by homeless populations, inadequate sanitation practices, and illicit drug use. Many individuals lacked consistent access to hand-washing facilities or other public methods of hygiene, and this allowed the virus to spread more easily within homeless encampments, shelters, and other community settings. The outbreak reached its highest point during the summer and the fall of 2017, when they were getting around 20-ish cases each week. And then the curve started to decline after this peak fall of 2017, and this aligns with the public health interventions implemented by San Diego County. And so officials declared a local public health emergency in September of 2017, and then a follow of a statewide emergency in October of 2017. During this, they administered over 160,000 hepatitis A vaccines, with 85% of them going to high-risk populations. And this was done through mobile vaccination teams that went around San Diego and visited these encampments or shelters, or specifically downtown areas, to directly provide vaccines. And then at the same time, the city of San Diego increased sanitation efforts. They installed hand washing stations, portable toilets, hygiene kits, sidewalk disinfection protocols, and temporary housing. Alongside that, they also implemented widespread public education campaigns and partnerships with local hospitals and other community facilities to identify new cases and encourage vaccination. Due to these interventions, we see a reduction in the number of cases reported weekly. So overall, the epidemiological curve demonstrates how hepatitis A was able to spread gradually through a sustained community of high-risk individuals. And then it also shows that through coordinated public health efforts, including vaccination, education, and sanitation, we were effective in controlling the outbreak and preventing additional cases. Thank you.